In 2020, we surveyed our members and we asked them about some of the social needs and social health issues that they've been struggling with. And food insecurity rose up to one of the top 3 social needs that were identified, with almost 30% of our members identifying access to healthy food as one of the challenges they're facing.
So at that point, we embarked on a human-centered design process to really design our strategy of what was the role of healthcare in being part of the solution and what was the role specifically of Kaiser Permanente. We came up with a portfolio of initiatives, and they were really aimed at increasing people's purchasing power, so things like WIC and SNAP, getting food to vulnerable populations, so things like medically tailored meals and produce prescriptions, and also being part of the national solution. In 2019, we started with a SNAP enrollment campaign. We wanted to test an innovative, inexpensive outreach campaign where we texted our members to help them apply for SNAP. And then we followed up with phone support for those who needed extra help.
I'm on a limited income, a little over $900 a month. And I was dealing with food banks, but the food banks, they give you a lot of food, and I'm so picky with the food that I didn't eat. Kaiser Permanente told me about this program, CalFresh, food stamps. And oh my God, it's just such a blessing. I'm better all the way around. It's like I'm in 7th heaven.
We think that we've helped over 30,000 of our members to actually successfully enroll in SNAP. And we think that that's put an estimated $34 million in people's pockets and $50 million in the local economies.
And what I'm really impressed with Kaiser is they have a deep commitment all the way to the top to addressing food and nutrition insecurity, not only in their patients, but in all the communities where their patients live.
The next initiative we launched was medically tailored meals. Our recently published study demonstrated that for patients with chronic heart failure, they had fewer hospitalizations when they received the meals post-discharge. This is a really compelling finding, and we look forward to more evidence being built across the nation so that health plans and health systems can really understand what works and under what conditions. Because this food as medicine concept is really building momentum right now.
Food is definitely medicine. What we consume, not only mentally and physically and internally, makes a difference. And so if you're someone who's struggling with food insecurity and you have to make decisions whether or not you have access to food you could feed your family, or if you have to buy medication, or wondering where you're going to lay your head at night, there's no possible way for you to be healthy.
So our produce prescription program, it really falls under this larger umbrella of food is medicine. So we know for a lot of things, a lot of the common chronic conditions that affect society today. So we're talking diabetes, high blood pressure, overweight, obesity, heart disease, heart attacks, strokes. All these things are extremely common nowadays. They're largely being driven by nutrition.
They signed me up, they called me on the phone, they asked me would I be willing to do it, and I was like, produce program, like, what's a produce program? And then they told me, and they were like, okay, we're gonna send you produce for 6 months. I said, you're gonna send me produce every week for 6 months? Yeah, are you willing? Yes, please sign me up really fast. It was exciting every week because it was different every week.
So far to date, we've sent 3,500 boxes to our patients' households, delivered to their front doorsteps, fruits and vegetables and other healthy food that really can help them address their diabetes.
Because of the fresh produce, it gave me more energy. I feel better.
For somebody to go to a doctor and hear that changing their diet is one of the most important things they can do to really make sure that they have their best chance at a long-term, vibrant outcome, and then can say, and we're going to steer you towards the resources that make it possible, that's the new day in healthcare.
The White House Conference on Hunger, Nutrition, and Health presented a unique opportunity to bring multiple industries together to figure out appropriate responses to some of these challenges that we're facing today. Kaiser Permanente is really proud to support these efforts by committing $50 million to do a few things. We're committing to working with our members who have food insecurity. We're also committing to help build the evidence about some of the food as medicine interventions that are really important. And finally, we're also committing to dedicate resources to partner with community-based organizations who are on the ground, who know their community really well to help us address these issues.
Food is so integrally connected to issues like health and climate and equity and fair treatment of workers. And it was great to have a moment to really stop and reflect on the ways that we can make changes to the food system and food policy that will help support the positive outcomes that we want in all of those key areas.
The work is out there, the work is ready and waiting for them, and people are ready to work. So am I.
We all have to roll up our sleeves, engage with other people, engage with other organizations, come to the community with a sense of humility, and try to be able to find solutions together.